Hello all, I am Dr. Anush Rangarajan, Consultant Interventional Neurology, Narayana Health. Today I will be speaking about mechanical thrombectomy. So, stroke is a medical emergency which can be recognized using B first acronym, as you all will be aware. B stands for balance issues, E stands for eye problems, and A stands for arm weakness, S stands for speech problems. So once you recognize these symptoms, you have to rush to a stroke ready hospital. So the good news is the stroke is fully treatable till 24 hours. When the patient comes to us, we'll be doing certain investigations, certain special investigations, and we'll be deciding whether we can do a procedure known as mechanical thrombectomy. So in this mechanical thrombectomy procedure, through pinhole, we go into the body of the patient, and we use aspiration, or we use stent retriever to take the clot out of the body. And this is when given at appropriate time, the patient can improve fully.